I'm David Lombardo, and this is WCNY's The Capitol Press Room, and we're going to share an interview we recorded for this month's television broadcast of The Capitol Press Room, which is available on your local PBS affiliates. We spoke with State Senator Jake Ashby, a Capital Region Republican, who's pushing legislation to give New Yorkers more flexibility with their insurance coverage if a healthcare provider they rely on suddenly becomes out of their network. The legislation stems from the real-life experience of New Yorkers in the Capital Region who found their coverage disrupted amid negotiations between health insurers and major healthcare providers in the area. This is our conversation with Senator Ashby, recorded earlier in the month. Well, thank you so much for making the time, Senator. I really appreciate it.
Thank you, Dave. Good to be here.
So the idea of someone's healthcare provider suddenly becoming outside of the network of their insurance coverage might seem like a niche issue, but it is something that is a persistent and ongoing problem here in the Capital Region. Can you explain a little bit about what people are dealing with right now?
You know, unfortunately, this has become more common than I think many people would like. Over the last couple years, during the summer, we would see people become out of network because of contract negotiations between insurance companies and health systems. And in particular, we had a constituent reach out to us because her mother had a cardiology appointment coming up, and then she was out of network. And what was going to happen there? And you know, there were carve-outs in place for some people's care, whether it was oncology or maternity care, they could continue, but there's a lot of other people who need critical care. So that's what prompted this legislation, because we believe that if someone becomes out of network because of an impasse in negotiations, they still deserve to receive care. I mean, they were still actively paying into this. And the disruption and lack of continuity that does, I mean, that's going to really be a negative, that's going to have a negative impact on care. It's going to end up costing more money later on down the road because of that disruption. So, you know, I think that this bill really aims to improve not only the quality of care, but also the continuity in both industries will benefit from this.
And the response is to essentially allow someone to go back into the marketplace if there's someone who purchases health insurance through the state marketplace, or maybe look at other plans that their employer offers if, for example, their existing plan no longer covers that network provider that they're using. Do you have expectations, though, that this is going to be a meaningful option? Is there reason to think that there is enough flexibility or variety of insurance options that someone will be able to find someone who covers the provider that they want?
I think that if this becomes law, it's going to provide a certain level of autonomy that is currently not there. And that, again, it will benefit both industries. It will benefit the providers, it will benefit the payers, it'll benefit the regulators too, because you're going to create a more permissive environment.
And in terms of this issue more broadly, is this something we're seeing more and more as, say, individual doctors become part of larger systems and they go to battle with their insurance carriers, or the insurance carriers go to battle with large medical systems? I mean, do you see this being a more persistent problem in the future?
I can't provide any quantitative analysis on that objectively, but anecdotally, it seems like it. You know, the number of complaints that we hear over the last couple of years, the number of articles, the number of conversations I have with people experiencing this problem seems to be rising.
And coming back to the idea of someone's provider going out of network for them, what can that look like? Why is that potentially a reason to expect that there will be a break in that continuum of care?
Well, this can arise from different types of negotiations, and unfortunately, at that point, the person is cut off from receiving the level of care that they're accustomed to.
I mean, theoretically, though, they could dig into their pocket and pay maybe higher copays or the cost of that care without the insurance coverage and just stick with the plan they've got. You're smiling because I think we both know how expensive something like that could be.
Correct, and I think that that's already happening even without a disruption,
Sure.
right? Negotiations taking place for different agreements. Even without a break in coverage, people are experiencing an increase in cost, right? Not necessarily an increase in quality of care, but an increase in cost.
Well, I imagine, though, there are people who are hearing you talk about the solution to this problem, and they're saying, wait, I got a simpler solution to this problem. If you want to make sure that everyone is covered by a certain insurance provider, why don't we just have a state-run insurance option that everyone can turn to, or just have a state takeover of the health insurance option? Why isn't that where you're going with this? Or maybe is that potentially something you're interested in, and this is a piecemeal or interim measure to think about?
Well, I think that's, I can understand how people would make that logical leap, but I don't believe that it's feasible when you look at what single payer has looked like in other areas, whether it's overseas or here, other states that have attempted that, smaller states with a more manageable population. Vermont has tried that a few times, and it would bankrupt their state. And I think we would see a similar thing happen here. I can appreciate how people would want that, but I do believe that it takes a certain level of compromise among all of the industries, regulatory, payer, and clinician, right, to make this work. And I think a lot of the issues where we see these issues come up is because of friction among those. That doesn't necessarily mean that we want to entrust the entire process to one entity. I think that would have catastrophic results.
Well, if we're going to stick with sort of the status quo framework we have, and coming back to that idea of an insurance company negotiating with a provider and trying to ensure that they stay in network, is there a larger role you think state financial regulators should play? Should they be at the table, so to speak, to try to help these people come together? Because it seems, at least from my perspective, that this is contained to just these two parties, and the state regulators are not necessarily part of that conversation.
Certainly, I think they could play a larger role, and I think that this bill would alleviate that from having to happen. But yeah, there are a lot of instances where I feel like people are left out literally in the cold without receiving care, and that there could be a role for the state to step in and ensure that, these entities are acting not only in their best interest, but the interest of the patient.
And what happens if, after, say, a protracted negotiation, the insurer and the healthcare provider come back to and make good terms? They kiss and make up, so to speak. Can someone then re-enroll in their previous insurance plan, or would they have to wait for, say, a traditional qualifying event like the start of a new year for them to go back to that previous plan?
So I believe that's the case right now. But many times what's happening is that these protracted negotiations are lasting much longer than the patient needs.
Sure.
So instead of having to wait, this would allow them the option of going on. Now, if they wanted to go back to their previous insurer, I'm sure that this bill would allow that.
Well, Senator, thank you so much for making the time. I really appreciate it.
Thank you, Dave.
And for more of the Capitol Press Room television broadcast interviews we record each month, check out our YouTube page or follow us on Instagram at Capitol Press Room.
Support for the Capitol Press Room is provided by New York State United Teachers, a statewide union of nearly 700,000 professionals in education and healthcare.